All states in the U.S. have partially reopened their economies following the pandemic lockdown, but many health experts have a warning.
The most important thing is to be careful, not to rush it too much. You need to have enough testing, and you have to have the ability to track down those who test positive and isolate them and stop outbreaks from becoming big problems.
In order to limit the risk of spreading the virus, some officials have floated the idea of immunity passports.
Many of those discussing that concept are actually talking about applying it to people that have been already naturally infected with this virus, and with the assumption that once they've been infected, they will be immune long-term, which, at this point is an unknown.
We're still learning a lot about what the antibody response means in this disease, and I think that's why, while it's likely that having been exposed to the virus and making an immune response to it will be protective in some way, it's really careful to understand everything about that before you make a pronouncement that it's safe to completely re-enter society or, take off your mask and so forth.
Both Professor Yang and Dr. Zander agree what's known so far about the coronavirus doesn't reveal the extent of immunity after recovering from it.
If we're fortunate and one of the current vaccine attempts works right off the bat and becomes available soon, certainly one of the big unanswered questions would be how long that immunity lasts and how often people need to be revaccinated.
So until a vaccine is proved to be effective and durable, having antibodies would not necessarily rule out the possibility of another infection.
Do some people have better antibody responses? Are there some antibodies that are better than others? I think the answers to those questions are likely yes. And a lot of people are investigating that, but I think it would be premature and unwise to assume that you're protected forever.
Since immunity passports could not be applied to our current situation, experts point out that returning to more social interactions could jeopardize progress toward containment.
But I see this as being like a tourniquet, right? So you apply a tourniquet to stop the bleeding, and it cannot stay on forever because you'll lose the limb. But on the other hand, if you remove it too quickly, the bleeding will resume. And I worry that that's the situation here. If we relax the restrictions too quickly before the bleeding is under control, then it'll flare right back up very quickly.
Officials believe there's a time and a place for so-called immunity passports, but first, this current virus needs to be better understood and hopefully eliminated. Ediz, Tiyanşan, CGTN, Los Angeles.